HIV and AIDS cases are increasing in the area. In 2016, North Dakota saw a spike in new diagnoses.
And it was Cass County that had the most new cases. Valley News Team's Rose Itzkovitz looked into the cause for the rise and where the numbers are at now.
In 2015, we saw about 27 newly diagnosed cases of HIV or AIDS, and then in 2016, we saw 50 cases.
Brenton Niesemeyer, an epidemiologist at the North Dakota Department of Health, says though the numbers are not large, the increase has been steady throughout the state since 2013. And last year, the number of newly diagnosed patients jumped 66%. Particularly, Cass County had more new diagnoses than any other county in North Dakota, at 15. Niesemeyer says the rise can be attributed to population growth.
We have a lot more people living here than we did 3-4 years ago.
In 2016, 42% of the newly diagnosed HIV or AIDS patients were born in a foreign country.
We're seeing a higher population of people who are from HIV endemic areas moving to North Dakota, where this may be their first time that they've ever been tested.
Sanford Medical Center's Dr. Dubert Guerrero says the high number is unique to North Dakota.
With all the risk factors, IV drug use, homelessness, and all that, we don't have that much here. I mean, we do have our fair share of IV drug users and that population, but we also get a lot of patients who are actually already diagnosed or were diagnosed by the time they actually get to our country.
But he says it's fortunate HIV patients can get proper care here in the U.S.
They get resources here, they get all the help and health care here, and we provide that for them, regardless of who they are, where they're from.
Other reasons for the increase include more self-reporting of IV drug use and more people getting tested.
We encourage people to be aware of their status, but if they're going to engage in risky behavior, seek out to your primary care doctor or infectious disease doctor about going on PrEP, which is your anti-HIV medicine. We encourage that with the use of condoms.
Rose Itzkovitz, Valley News Live.
Well, that report specifically looked at Cass County and North Dakota. On the Minnesota side, according to the Department of Health, the state saw a 41% increase in HIV and AIDS cases since 2015, and diagnoses among injection drug users increased over the last 2 years.